Hi, I'm Dr. Blair Masters with Arkansas Physical Health and Rehab, and I wanted to talk to you today about what we call long haul COVID or post-COVID syndrome. We are still getting people that come in on a regular basis and have complaints that have just kind of stuck around since COVID. And they had a recent article out in Chiropractic Economics, and so it's kind of timely here. So what's the big takeaway? What's the deal? Almost 50% of COVID patients suffer from symptoms 4 months. That's half the people 4 months later are still having problems after their infection. Every person with long haul COVID is kind of different, but we've seen lots of different kinds of symptoms. Chronic cough, I just don't feel good, I can't quite think right, but there's lots of stuff you can do. Lifestyle is huge. Obviously, what you do on a daily basis is going to affect your health. Your nutrition, supplements. If you're not taking supplements, you're relying on your diet for your nutrition, and that is not enough. Here at the office, we offer laser that gets great results with all sorts of different problems, including infection, chiropractic adjustments. They have done study after study that show chiropractic really plays a really significant role in managing these kind of symptoms and helping them go away. So this international study that was done, they found people who had long haul COVID or long-term effects from COVID, about 80% of them suffered from fatigue. And then 73% suffered from post-exertional malaise. Well, what is that? What's post-exertional malaise? Well, fatigue that only shows up like after exercise or after a long walk, or even worse, some people are just like walk up a couple flights of stairs and they're like, oh, that just about killed me. You know, those sorts of symptoms are really bad. Cognitive dysfunction, 58%. And this is what a lot of people mention to me. I just kind of don't think right. I'm just not as sharp as I used to be. And that's really bad. Headaches, 54%. Memory issues, which these kind of go together, 51%, and then joint pain, just achy all over. You know, that's these sorts of symptoms just kind of hang on. Now, long-lasting consequences. This was a health insurance industry study. They suggest positive COVID illness, even if it's mild or moderate, or even asymptomatic, 75% of people are plagued with one or all of these COVID symptoms. Shortness of breath, cough, brain fog, abnormal heartbeats. Ooh, that's a scary one. I had a child come in who was suffering from that post-COVID. And then sleep disorders. I just can't sleep right, that sort of thing. These sorts of things show up afterwards, even if somebody's had a COVID infection and they didn't have really much in the way of symptoms at all. So what can you do about it? Over 50 documented long-term effects. What can be done? Well, that's one of the reasons why people come to us. First of all, get ahead of this. One of the first videos I did when COVID started was take more vitamin D. Supplementing makes a huge difference. Eliminate inflammation-producing foods. I've talked about this in many of the videos that we have on YouTube, and you can reference those. I would encourage you to do that. But grains, anything that contains a lot of omega-6 fatty acids is going to be pro-inflammatory. Anything that is full of sugar is going to be pro-inflammatory. And if you've watched the news at all during this COVID thing, you know that COVID is kind of this inflammatory cytokine storm is what they call it. And it just kind of creates this inflammation that grows on itself. It's kind of scary. But exercise, it is the universal prescription. It helps everything. It really does. Improve your intestinal health. They have linked intestinal health to your immune system over and over again. It's really good for you. Get chiropractic adjustments. They've done tons of studies. They took people's blood before an adjustment and then after an adjustment and saw an increase in the white blood cell activity. It boosts your immune system. It helps you get over stuff like this. It improves your nervous system function. It decreases fatigue. It reduces joint pain, improves your sleep patterns. And these are just a couple of the benefits. So if you or somebody that you love is suffering from post-COVID problems, or you just don't feel good, come into the office, give us a call. It's 479-443-0800. Give us a call and we'd be happy to sit down and talk to you about what's going on.